So I'm going to go ahead and get started with the presentation. Welcome everyone, and thank you for joining us today. My name is Kimberly Mankis, and I am a health educator at the Maxwell and Eleanor Blum Patient and Family Learning Center here at Mass General.
And I am Mariam Daib. I'm also a health educator here at the Blum Center. Before we get started, I would like to go over a few things. Please note the session is being recorded for educational purposes. If you are interested in viewing this recording, it will be made available on the Blum Center website at massgeneral.org/Blum Center. If you are in listen-only mode, everyone has been muted to eliminate background noise so that we can hear the speakers. If you have a question, please use the chat feature at the bottom of your screen. Only Blum Center staff, the co-hosts, and the guest speakers will see your questions. We will have time at the end of the session for them. Please do not share any personal or medical information or questions in the chat. If you have a medical question, please ask your doctor.
Thank you. So next, I'd like to introduce Susan Edgman-Levitan. She is Executive Director of the Stoeckel Center for Primary Care Innovation. She also leads the Patient, Family, and Clinician Engagement for the MGH Continuum Project and is co-chair of the MGB Patient Experience Leaders Committee.
Thank you. And welcome to everyone on our town hall today. And first of all, I want to thank the Blum Center for giving us the opportunity to share this information with you. One last little housekeeping detail is if your screen becomes jumpy or you're having a hard time hearing us, you might want to turn off your video because sometimes that improves the internet connection. So with that, I'm going to introduce our speakers today, and we will get right to the content. And then at the end, we'll have time for your questions. So please put your questions into the chat, so hopefully we can address all of them. Our first speaker today is Dr. Matthew Russell, who is the Clinical Director of Geriatrics in our Senior Health Practice. And our second speaker is Dr. Erica Wilson, who is one of our palliative care physicians in the Division of Palliative Care, and also leads all the technology work that we do as part of the Palliative Care Continuum Project at Mass General. So with that, let's go straight to Dr. Russell. And actually a big shout out to his mother, who's on our call today.
Hi, Mom.
So
Hi,
go
everyone.
ahead.
Thanks so much, Susan. I really appreciate the chance to speak to you all about where things are currently with COVID and where we see ourselves going in the next few months. For many of you, you may know that we have been trying to do patient outreach since the start of COVID, tracking the issues that are active in those moments. So much of what we did earlier on in our patient outreach is actually probably outdated at this point, because now we know a lot more about this virus and ways to keep safe. So I'll just start with the basic overview of transmission and infectiousness, because I think this is where people really do want to get their questions answered. And we all know about the social distancing and the hand washing, but getting a real sense of how do I manage the nitty-gritty of my life in terms of this virus is also really important. So COVID is a virus that's transmitted by respiratory droplets, and in some cases airborne, although we don't have clear data about that. What we do know about COVID is that people are, as with many viruses, most infectious right before they become overtly symptomatic. This is important to understand because as you are talking with your friends, your family members, and your neighbors, many people are speaking, well, I know if I'm sick, I won't go out. But this is why we recommend masks and social distancing, because often the horse is well out of the barn by the time a person becomes symptomatic. Additionally, we also know that people can be contagious without really experiencing profound COVID-like illnesses. So they are what's called a vector for the illness. They are not profoundly affected or impacted, but they're able to transmit that to someone who may be. So in terms of how long is someone infectious for after they have been infected, generally speaking, we're looking at 7 to 10 days prior with the symptom resolution. So people are most infectious to half a day before they become overtly symptomatic. And in that last half a day before they become symptomatic, that's when they are most contagious. So again, just driving home that point that it isn't, that person who's sniffling and sneezing and coughing that is the worry, because presumably that person has the personal awareness to say, geez, I shouldn't go out in public. But it's the unsuspecting person in the grocery store not wearing a mask, or the person out in the park not wearing the mask walking by you. So then in terms of what does that mean for managing my risk as a patient? What we generally recommend is that we are all agents of our own destiny in this. For many reasons, the issue of mask, social distancing, and quarantine have become something more than what they really are, which is infection control. And that's really our recommendations come from a place of infection control. So the first thing is social distancing. What does social distancing mean? Yes, the actual distance of 6 feet when you are out in public. Also, social distancing in the way that you're conducting your life. The more that you are coming into contact with crowded areas, whether it is a college fraternity party, which we heard about that, or whether it's a family reunion that's well-intentioned, but a large crowd of people, these are things that can impact infectivity just by probability. And as you just think about in the Boston area, we are facing an influx of over 100,000 individuals who are coming here for their schooling from all over the country. So we expect that these mass shifts in crowd will impact infectivity and the prevalence of the disease. Again, what can I do about that? I'm not going to call the deans of all the colleges and say, bad idea, don't do it. I'm going to say, I'm going to stay socially distant. I'm going to avoid large crowds. I'm going to wear my mask. And if I do have gatherings in my home, I'm going to observe social distancing, preferably outdoors with enough space and fewer than 10 people. These are the standard precautions that we all recommend. Right now in Massachusetts, we're enjoying a relatively low spike in our COVID. But we really don't know what it's going to be a month from now. And that's absolutely the nature of what COVID has been like since the start. So we are trying to stay up with the day-to-day, month-to-month, week-to-week. In terms of what are other things to be concerned about, congregate living. So people who are living in nursing homes or assisted livings, or even those folks in prison, these can be places where once a virus enters that space, it does spread like wildfire. And we know that the majority or a large percentage of the deaths of COVID patients come from the nursing home patient population, and the deaths way overrepresent the actual percentage of our population that spend time in nursing homes. And I'll just look and see, I think there was a question in the chat box that I can answer. Let's see. What do we know about outdoor transmission? How should I play it when my kids are wearing masks, are not following the 6-foot rule around kids they are interested in the park? Yes. So I always like to hearken back to the AIDS crisis in the 80s. There used to be this thing called safe sex. People would talk about safe sex, and then it became safer sex. And this is what we are really talking about, is risk mitigation. And so if there are ways to do play in a way that maintains the social distancing, or that you're kind of quarantining in a bubble with other families that allow the children to play, these things might be possible, but it really is hyper local and hyper contextual. How can you decrease the risk of transmission, assuming that the children are in the same cohort and are only seeing each other? That is a lot less risky, assuming they're all negative. But if you're dealing with multi-generational homes where you've got children going out into school, may come into contact, and then come and visit an older relative, that could, or an immunocompromised relative, that could be a risk. So I always like to just, rather than speaking in absolutes, really think about risk mitigation. So I hope that makes sense. So, all right. And I have -1 minute left. So if there's anything else, Susan, that you think that would be helpful for me to address, I'm happy to do that.
I think you've got a little more time today.
Okay.
And so you've got a couple of other questions about, I'm sorry, is it safe to be on the T? And then I think one of the things that we often get questions about in our town halls is the issue of immunity. And so if you might want to say something about that, but there's also a question about, is it safe to ride the T?
So if you have not already been on the subway, I will tell you, I take the red line to work. And the red line is full of people with masks and scrubs and sitting well 6 feet apart. I think that the subway etiquette, speaking at least for the red line, is it's not particularly crowded because many people have opted for work from home. Secondly, many of the people that are going in are healthcare providers and are following appropriate social distancing. And also I carry a hand sanitizer with me, and I don't touch anything on the subway. So again, I feel like this, for me, as I walk into a subway car, if it's crowded or I see somebody not wearing a mask, I'm moving to another car, or I'll wait for another train. And I think that's the added planned time that we should do. Can't speak to the buses. But again, I think it's reasonable to expect that many seats could be blocked off. And if you don't see that, don't get on that bus. The issue of immunity. Oh, sorry, Susan, go ahead. What were you gonna say?
Go ahead.
Okay, the issue of immunity is really still a hot topic, because we are finding that people are able to generate antibodies, and the antibodies are effective against the infectiousness of COVID. How long that immunity lasts, however, and which antibody is the sort of the holy grail for the vaccine, that is still very much in development. And I'm sure we've all heard of the many vaccine trials that are underway right now throughout the world.
Okay. So let's move on to Dr. Wilson.
Sorry, I had to unmute. I'm Erica Wilson. I'm a palliative care physician, as Susan said. I've been practicing for just over 10 years here at Mass General. And one of the things that I've been doing, in addition to taking care of patients, is helping our staff, training our staff and patients and families to think about what matters most. And here's what I mean by that. I'll tell you a little story. There's lots of moms in our call today. I have a mom who's 93, and my son and I moved in next door to her several years ago to give her a hand to help her out. And my mom is a woman who's very easy to love. She is creative and funny. She's a lovely woman. She is a challenging woman to help. She's fiercely independent, and as an example, she does her laundry in the basement of her home. It's an old Victorian home that I grew up in, and she tosses her laundry down in a bag down the dark and steep stairs. She does her laundry, and then to come back up, she puts the bag up 2 stairs in front of her, and then she walks up the stairs, and then 2 steps more, and that's the way she does her laundry. And this is a woman who has failing eyesight and has fallen several times. Now, I am her daughter who loves her dearly and a palliative care doctor. And so my brother and I got together and we've hired someone to do her laundry. She's furious at us. And I think this story really illustrates some important things about my mom and what matters most to her, what her kind of deepest values are about her life. She's very independent. She does not want anything that is going to kind of impair her sense of her own dignity and ability to care for herself. And so when we think, my mom is not shy, and so she is, she's been really clear with myself and my brother and her doctors about the kind of care she wants. And that care falls out from what kind of person she is and what's important to her. And so we've been training staff at Mass General to have these conversations over time with their patients. And they really are conversations about what's important to you. What are you worried about? What are you hoping for? And if you were to get sicker, what's most important? And those conversations change over time. So when my mom was 50, she would have had different things to say than she does now that she's 93. And so they're conversations that happen over time. And we have a way of recording those conversations and noting them in our electronic medical record so that whole teams can see this and share in knowing about what's important to you or to our patients. So in regular times, these are really important conversations to have, not only because it affects the way we think about medical care, but especially now with COVID, many of us are kind of craving this ability to be seen and heard, to have our voices heard and to be known. And so these are great ways of sharing that information with your whole medical team. They can help small decisions, like, for example, my mother has very labile blood pressure, it goes up and down. And so we've had to work with her cardiologist to think carefully. She's a walker. She walks, you're not surprised to hear, every day, no matter what, in these big floppy hats, walking around our town. And we had to make a decision to prioritize keeping her blood pressure not as well controlled to decrease her risk of falling. So that's a good example of kind of these everyday decisions that we made. How do medical care fit your life so that you live the way you want to, or if you can? And then when COVID hit in the spring, and at Mass General, we had this really terrible surge in patients who were showing up desperately ill. And it really highlighted how important these conversations and in particular, having a designated healthcare decision maker, it really highlighted how important that was. So when COVID hit us in April, I was working in the emergency room. And we would go in to see, me and my colleagues would go in to see patients. We put on our masks, we put on our gowns, we'd get, completely gowned up. And I would go in with my phone or an iPod, and talk to patients and to have these conversations. Now that you're ill, what is most important to you? How do we, and tell both them and their family about what was going on. And a really important part to think about of this pandemic in particular is that families were not allowed in the hospital. So as you can imagine, these were very ill people who were here by themselves. And being in the hospital is scary and stressful. We're asking hard conversations and giving difficult news. And so it really highlighted for me how important it was to have conversations about this beforehand. And if you're not able to make decisions for yourself, if you're so sick you can't speak, which was true for many of those patients that I saw, having someone who I know was the right person for you or for that patient to talk to. So I wouldn't pick up the phone and talk to your spouse if really I should be talking to your daughter. I think from my standpoint, there are a couple kind of take-home messages. One is these are thinking about what matters to you, what matters most to you in the context of your health. The context of your health to support the life you want to live is important. Communicating that to your medical team, important. And talking about that with your family, and then making sure, most importantly, that you have designated a healthcare proxy. In Massachusetts, it's called a healthcare proxy agent. And there's legal paperwork that can be filled out that needs to be signed, and ideally to appoint 2 of those people. So if we can't get in touch with the first person, we have somebody else to fall back on. We do worry that there may be a increase or rise in cases, as Matt pointed out, that all the students are coming back. We will be moving more and more indoors as the weather in Massachusetts, as we know, is not compatible with outdoor life when we hit the winter. And so there is some concern that cases will rise again. And so I want to make a very strong point to make sure you have a healthcare proxy and spend some time thinking and talking about this with your family and your providers. And I'm happy to take any questions. And I think I'll hand it over to Susan now.
Yeah, Dr. Wilson, I have a question. Can you say a little bit more about when we're thinking about what matters most to us, what are some of the things that we should be thinking about? Like, I think about if I were too sick to ever be able to talk to my family again or to read, which is something that I really love, then I might feel very differently about what kinds of treatments I would want to have versus if I could still continue to do those things. But could you say a little bit more about the kinds of things that people should be thinking about? Because there's a continuum.
That's a great question. What you're talking about, one of the things you pointed out was function. What are the things I want to be able to do?
Right.
So for my mom, I keep going back to her. She was an English literature major and a teacher. She was a reader. And she has slowly lost her vision, and so has now gotten used to listening to books on tape. So an important thing to think about, it's important to think about function, things that are deeply important to you, but we know that people adjust and they make different decisions depending on where they are in their life and what's possible. So function is an important thing to think about. This idea of your goals and values and is in some ways, to my mind, the most meaningful, because getting a sense of the kind of person you are can help us and help your family make decisions that are in the moment. So for example, if in the setting of COVID, for example, there is one of the things that people often worry about is if they get so sick, they have to go to an intensive care unit. Or sicker still, they're not able to breathe on their own and require intubation, which means a breathing tube is put in and a machine helps you breathe. You can't think about those decisions separate from 2 important things. One is the goals, the values, the priorities, the function that's important to the patient, and what is the medical situation. So what I mean by that is, if you are 80 years old, relatively healthy, high blood pressure, and walking, talking, functional, then while there is a risk of going to the ICU and being intubated, it's a medically reasonable decision, as long as it also fits with who you are as a person. Some people say, I would never want that. So we need both of those things to match. On the other hand, there may be people who are so ill, even before COVID, that their doctors say, even though it's possible to bring you to the ICU, our concern is you're not going to do well. Now, bringing it back to my mom, I would say to the critical care doctors, what does that mean, not do well? And they may say, there's a possibility that she wouldn't survive. That's important to know. They would also say, it's really likely that she will end up so debilitated that she will have to go to a nursing home permanently. So we would take that information, my brother and I, and hopefully my mom, and think about the medical piece as well as what's important to her. And these are hard decisions, and struggle to make a decision about what the right thing is to do. Many of our patients have said, you know, that is not for me. If I'm not going to do well, I want to be with my family. I want to be at home, or whatever fits with their model or thoughts of themselves and their family. Does that help, Susan?
Yes, it does. Thank you. Thank you. So Dr. Russell, I have a couple of questions for you. One we got is about whether it's potentially going to be important to wear a mask at home, particularly if you're living in a multi-generational home. And then a second one is, can you continue on and say a little bit about what we are thinking and how we're preparing in the event that there is a second wave? And how will that, what do we know about how that might compare to what we experienced in the spring?
Great, thank you so much. So the first thing is, for those living in multi-generational homes, so for example, where children are going off to school and you might have an older relative living in the home, does it make sense to do social isolation? It totally depends on the schema for the kids' education. Sometimes they're doing the bubble thing where they're doing it, you know, in class for, you know, 14 days or at home for 14 days. So I think it's important to track where the folks are coming from. Another risk category is those of us who work in healthcare. When we come home, are we bringing anything home with us? And that's just always been, you know, as healthcare workers, what we have to what we have to do to protect ourselves. And it is, again, risk mitigation. So if I have been wearing personal protective equipment in a congregate living area, such as nursing home, hospital, assisted living, I've minimized my risk of acquisition of disease. I'm using appropriate hand hygiene. So I've taken the maximal number of risks that I can take. And we know now a lot more about how to keep ourselves safe as healthcare workers to reduce the risk of getting this disease. So we're minimizing our exposure to patients through many different strategies, whether it's reducing the number of contacts we have to have as healthcare providers with the patients, reducing the number of times we have to medicate them, which as a geriatrician is a great thing, because if we can cut down on unnecessary medication, that often improves quality of life for many of our patients who are most at risk. And then if there is a fear of exposure and you are living in a multi-generational home, we are recommending that people socially isolate. So I dedicate themselves to their own space in the house where they are using their own bathroom, their own bedroom, and they are not interacting with the other members of the house with whatever is possible. And certainly if there's unavoidable contact, both people should maintain a social distance and wear a mask.
Can you see, yeah, go ahead can I just ask you one other question related to what you were just speaking to? And that is, can you say a little bit more about because we may have people on the call today who are essential workers working in other industries where they have a lot of contact with people. Can you say a little bit about what we're advising all of our colleagues in healthcare to do when they come home, to make sure they're protecting others in their home.
Right. So the answer is not going to be anything earth-shattering for anyone on this call. We all know that this isn't where you have to go in and take a decontamination shower and suit up and everything. Generally speaking, COVID does not live long or to significant degrees on inert surfaces. The main modality of transmission is respiratory. So if we are washing our hands, maintaining social distance, I never think it's bad to take a nice shower after work anyway. But I think for most people who are new to this potential exposure, who aren't healthcare workers, these techniques of maintaining social distancing, using the hand washing, and doing the reasonable decontam that most of us do when we get home.
Okay, so do you want to talk a little bit about what we're thinking about with peaks?
Yeah, the issue around second wave really depends on predictability. And if there's one thing we know in this country, unfortunately, specifically, we do not have predictability in our model, because there are some areas of the country where it's sort of a free range virus growth, whereas in other parts there's a little bit more control over tracing, testing, whatnot. I think what those of us in the Boston area are faced with is an influx of people from all over the country. So this is probably the thing that will actually speak to what we're going to encounter. The rest of our economy and our region seems to be pretty static, but this is the big variable that's coming down the pike for us, and it'll sort of tell us, are we in good shape? I'm hoping, and I think most of the epidemiologists are hoping, that the severity of infectivity and will be lower because of our ability to trace, track, mitigate, and let's face it, the thing that's different this time around versus when it was first starting is everybody's on alert and knows what's at stake. So we can't stop people in their 20s from being people in their 20s, not to disparage, because we were all in our 20s at one point, but certain decisions may not be the priority over others. And, we would hope that just like we're seeing in other parts of the country where universities are experiencing outbreaks, they're taking the appropriate steps to tamp it down. So I'm hoping that it will not be a significant, it certainly doesn't sound like we're going to reach that same level of surge that we experienced in the first wave. The reality for many of our patients, however, for those who are older with multiple medical problems or immunosuppressed, is that the isolation needs continue. And we didn't talk about this, but this is also a very important thing. Well, two things. One, our risk of isolation and what that does for our health and our well-being. And so when I talk about risk mitigation and safer risk profiling, one does need to acknowledge that you have to be very intentional how you help people manage their loneliness and isolation. And so if you have older people in your family who are not able to get out as much, or who are not engaging in things like online Zoom meetings, this is essential. Once you get over the Zoom thing, once you get over the barrier of electronic communication, our desire as humans to stay in connection with one another takes over, and it almost becomes non-existent, the barrier. So I just encourage people, if you have, a millennial who can talk to the older member of the family, get them online, show them how to do this. They can start scheduling Zoom calls with their friends, Google Duo, or whatever. But that's really important. The second thing we want to talk about is, as we are going into the autumn and the winter, we are going to be in flu season. And it is very important for everyone to get their flu vaccine when it is available. And I see in some commercial pharmacies, they are advertising for the flu vaccine, and that is the same vaccine that we're giving in our offices. So I encourage you, please get your flu vaccine as soon as you can, because the last thing we want to have is someone, not win the anti-lottery of getting both COVID and the flu. Because these are the, that is an annual thing that happens to all of us. And if we can mitigate that risk, that will be very important.
Okay. I have another question for you, and that is I'm a faculty in one of those universities you've been speaking about. I will be going back into the college classroom and run most of my science lab classes in person. What advice would you give this person about staying safe?
Excellent. So this is actually, this particular question combines a lot of lab safety stuff, which is actually really good infection control stuff. So maintaining safe distance from learners, using appropriate eyewear. So in say, for example, a chemistry lab, we're using goggles. So we are using in hospital situations, plastic face shields and surgical masks, just as a routine when caring for our patients. So that would be the thing that I would recommend. Now, it's really important for those of us who are teaching to attend to any visual or hearing deficits that our learners might have. And so for that, I just recommend that if this is an issue of someone who has to read your lips, they are working on and have developed some clear masks that allow your lips to be read. And similarly, if this is something where we need to figure out whether we use a microphone or what, but these are really important things to consider. And I hope I answered that question for whoever asked that, because things like office hours, what are office hours going to look like? That is a tried and true postgraduate and baccalaureate experience, or even in high school. Like, if I'm hosting office hours, is that going to be in person, or is that going to be something I do virtually? I would obviously recommend the latter, because these are oftentimes very, personal discernment conversations as we're trying to figure out our next steps in our academic lives. And we want that to be a private space, but we also want to recognize that's a place where people can cross-contaminate. So I hope that helped.
It does. Are there other questions? Oh, we do have another question, an important one again.
Yeah.
Can you say a little bit about social bubbles, or some people call them pods, with friends, only meeting with the same group who agree to observe social distancing and whatever?
Yeah, so I actually had a very unique experience about this. I was picking out a tombstone for a family member, and I was speaking with the woman who works there, and we were talking about what this all means. And she said, all the soccer camps, all the ballet classes, everything is canceled. And the kids looked at me and said, well, what am I going to do now? And she said, go out in the backyard and handle it like we did in the 70s and 80s, figure it out. Within 2 days, the neighborhood kids found each other, and they're in the backyard building forts and enjoying themselves. And I think that some of these things happen naturally. And if you can coordinate with a social group to ensure that you are all doing the same level of social distancing, minimizing contacts, mask wearing, and you share the same space, that is risk mitigation. But again, these things make it hard for when we veer away from the rules. Like, if we violate the rules, am I going to tell the rest of the folks in my pod? And so what I would just encourage is, as you set these things up, build in space for us all to have our human foibles, so that we can all have the right to make the decision, okay, let's wait a couple of weeks then before we get together again if you think you were exposed. This is sort of a long haul, because it is going into the winter time, and we really, unless you're buying outdoor heaters or you're blessed with some other kind of way of being outdoors, it is a challenge.
Thank you. One quick comment I want to make, because we did get some questions about schools and children and whatever, and I want to make sure that everyone on the call today is aware that we are planning another town hall in September that will be sponsored by Mass General for Children, so our pediatric department. And it's going to be focused on what is a decision-making process that you can use to help you decide whether your child should go back to school in person, a mixture, or be, in a remote learning situation. And we're going to share some tools that may help people think through these decisions, talk a little bit about the infectious disease components and other things that might be helpful. And that town hall, because of the audience, is probably going to be in the evening. So there'll be more information posted about that in several different places. But if people are interested in that, you might want to reach out to Kimberly or Mariam to find out the details, and we can make sure you all have those. Because we know that there are lots of questions about that in the community, and also actually with a lot of the people that work in healthcare, who are trying to figure out how they're going to manage children that may be in lots of different places and settings around the school year. So I wanted to share that. There's another question, and that's about virtual care. And I think it's about virtual care. Oh, this was more in response to the question about office hours that will be done virtually. But I guess one other thing, since we've got a little bit of time, is whether Dr. Russell or Dr. Wilson, you want to say anything about the kinds of things that are really important to come in person, what we're doing to make sure that all of our hospital settings and practice settings are safe, and then also say a little bit about the virtual care that we're providing.
Definitely. Dr. Wilson, do you want to go first?
I work only on the inpatient side. So Matt can talk about what happens when you go to clinic. But in the hospital, there are universal precautions that everyone is taking when you come into the hospital. So we're limiting the number of people that come in. So only patients or staff who need to be here, and a limited number of visitors. Everyone who comes in has to sanitize their hands and wear a surgical mask, and that happens everywhere in the hospital. As clinicians, we wear goggles, as Matt pointed out, and we know, because we monitor the rates of infections in the hospital, that the rates of infection among our staff has been quite low. So we've been very successful at keeping at least the hospital space safe, both for staff and for patients.
Yeah, and building on that, when we went into reopening mode, we all had to comply with the infection control of our incident command center, and we still are doing that. One thing that was very concerning when the outbreak started was so I'm a geriatrician, and we were proactively reaching out to our patients to make sure that they were getting their care, that we were preventing them from having any decompensations. But there were instances where some folks did have an active medical problem that really needed to be assessed in the hospital, in the emergency room. They did not want to come in for fear of contracting COVID. And balancing that fear of the hypothetical versus this is what's actually going on, and I'm really worried about the actual, is something I feel we're in a much better place now for all the reasons Dr. Wilson referenced. This is why we want to make sure that you're staying in touch with your healthcare providers. If you have chronic concerning issues or any concerns, call them. We are doing virtual visits, which in my line of work, our patients and families love, because getting our patients sometimes into Boston, into the clinic, is very challenging. And this is a way for us to stay in contact, where the modification we might make at this point is a little thing to impact majorly, rather than waiting for things to decompensate to the point where we don't have a choice but to hospitalize. So check with your providers and see, are we doing virtual visits? When you want me to come in, what precautions are you taking to keep me safe? This is true as well for dental care. If you have routine healthcare issues that need to be dealt with, I wouldn't put them off necessarily because of COVID, especially because we're in a little bit of a nice bubble right now. I would check with whatever provider you're reaching out to, whether it's a physical therapist, a chiropractor, a massage therapist, a dentist, whatever, and say, how are you going to keep me safe?
Okay, thank you. One thing just to add to that, because I know that our patients have had a lot of questions about what we're doing, both in the inpatient and the ambulatory setting to keep things safe. And we actually, every employee who comes in every day is tested. With their temperatures taken, they have to attest to any symptoms they might have. So we're doing everything possible that we can to keep people safe. I think we don't have any more questions, so I think we may be ending a little bit early. We really, really thank you for your participation today and for actually giving us so many wonderful questions. And I also just want to remind people that the recording will be available on the Blum Center website at massgeneral.org/Blum Center. And these also will be going on the MGH YouTube channel, which is a very cool thing that you might find a lot of other interesting shows on if you care to take a look. So with that, I want to really thank everybody from the Blum Center for giving us this opportunity today, and also Dr. Russell and Dr. Wilson, and also to Dr. Russell's mother for joining us today. So thank you all, and I hope you have a wonderful afternoon.
Take care.
Take
Thank you.
care.
Thank you.
Bye.
Bye-bye.